Hi, everyone. I'm Laura Pyle. I am the director of the Child Health Biostatistics Core. Next slide. Our mission is to provide biostatistical services to investigators involved in child health research on the Anschutz Medical Campus. And we support rigorous research design and analysis. We do a lot of mentoring of students, junior faculty, and investigators. Our costs are subsidized by the Research Institute. And we currently have 14 faculty in our core and 2 graduate research assistants. Next slide. We perform some of the same roles that you've heard about from the other groups. We can share our expertise in statistical approaches. When you're developing your study or designing your study, we can discuss limitations and strengths of different study designs, and we can assist you with data visualization and interpretation. Again, come early and often when you're designing your study or developing your proposal. We can provide input on specific aims and study design and do power and sample size calculations, help you write and review your analysis plans, and prepare protocols and grants. And we, of course, can advise on statistical methods and provide data analysis and results and tables, figures for abstracts, posters, oral presentations, and manuscripts. Next slide. Some of the same methods that you've heard before that we can perform, regression methods. I won't go through all of these, but just to point out some of the important ones, things that might be particular to child health: growth curve, Z-score development, group-based trajectories, things that have to do with development, omics analysis. Next slide. SEMs, we can serve on DSMBs. We have people who have expertise in survey analysis with complex designs, qualitative and mixed methods analysis. Next slide. We have people who have expertise in clinical trial designs, observational studies. We can do randomization methods and schemes. And one thing that I wanted to point out also is that we do provide consultation on REDCap and database design. So again, coming early and often as you're collecting data, please come and have us take a look at your REDCap database, and we can provide any input and make sure that your data are easily analyzable at the end of the study. Next slide. Same kinds of data types that we've talked about before, including EHR data, randomized clinical trial data, specialized databases such as NHANES, the Pregnancy Risk Assessment Monitoring System, and the Pediatric Health Information System. We have some experience with wearable and sensor data. Next slide. Also gait data, omics data, and immune data. Next slide. So how to access our services: you can contact me for new projects to set up an initial consultation. If you have a quick question and just maybe want some advice on what methods to use, you can schedule a consultation with us online using the Calendly website. At the initial consultation, if we determine that more than 1 hour is needed, then we'll provide an estimate of the number of hours that will be required for your project, and we'll help you get the project registered for further support. And if you are working on developing a grant proposal, please contact me for assistance with the budget development. Next slide. Our cost structure: we provide 1 hour free consultation for all projects. We also, like the other groups, provide 40 hours of free service for grant preparation if a biostatistician is included in a budget. For short-term projects, these are the consultation type projects that Nicole mentioned. We define these as less than 100 hours of work. We bill on an hourly fee for service rate, $35 an hour for students and junior faculty, $45 an hour for assistant professors and above. And for longer term collaborations, we charge on an FTE basis.